welcome to the SVG-TV news for Tuesday, September 21st. I'm Khalil Kato with the details. St. Vincent and the Grenadines on Monday recorded 2 more COVID-19 deaths. The latest victims are an 88-year-old female and a 51-year-old male who died from COVID-19 pneumonia. A release from the National Emergency Management Organization, NEMO, said both victims were unvaccinated and tested positive for COVID-19 on September 14th and 17th, respectively. Their deaths bring to 16 the number of persons in SVG who have died from the viral illness. Meanwhile, 50 new positive cases were reported from 90 samples processed on Sunday, resulting in a positivity rate of 16.7%. NEMO said all cases are contacts of positive or persons seeking care. It was also noted that there are currently 19 patients at the Argyle Isolation Facility. 18 are unvaccinated and 1 patient is partially vaccinated. No new recoveries were reported over the reporting period. 488 cases are currently active and 16 persons with COVID-19 have died. 2,845 cases of COVID-19 and 2,341 recoveries have been recorded in SVG since March 2020. NEMO said in view of the confirmed presence of the Delta, Mu, and Gamma variants in the country, and the significant increase in the number of new infections, transmissions, and severe COVID-19 disease, strict enforcement and deaths, strict enforcement and compliance with all protocols are recommended by everyone. The Emergency Management Organization said the correct and consistent use of masks, avoidance of crowds, physical distancing, proper hand sanitizing, and immunization with available vaccines have all been proven to significantly reduce the risk of being infected, getting sick, or dying from the COVID-19 virus. Police Sergeant number 569 Lawrence Thomas has been identified as one of the 2 persons who died on Monday from COVID-19. The confirmation came in a news release from the RSVG Police Force today, which noted that Thomas's death has been classified by the health authorities as COVID-19 related. Thomas, who was unvaccinated, reportedly tested positive for COVID-19 on September 17th and died at his home on Monday after complaining about experiencing difficulty breathing. At the time of his death, he was stationed at the Caliacor Police Station in the South Central Division. Extending condolences to his family and friends, Commissioner of Police Colin John said police officers are on the front lines every day dealing with reports and interacting with members of the public, and it is imperative that they take every precaution necessary to protect themselves, their families, and the general public from the coronavirus. Commissioner John encourages all police officers to strictly observe all of the protocols and recommendations against COVID-19, especially getting tested and vaccinated against the viral illness. And speaking on the Police Beat program on NBC Radio last evening, Assistant Superintendent of Police Junior Simmons used the opportunity to urge all rank-and-file members of the RSVG Police Force to take the necessary precautionary measures to protect themselves and their families from COVID-19.
So I really want to encourage my colleagues in the police force to do everything to protect yourself from contracting COVID-19. You need to wear a mask, sanitize, social distance. You need to also get immunized against the virus because we are no match for the virus.
Several police stations had to be closed due to the recent surge in COVID-19 cases on island. ASP Simmons noted that the virus can also affect the duties of police officers in securing the people of SVG.
Officers, we are not superhuman. We are mortal, flesh and blood, just like everyone else. And so, we have been under attack as well. From the virus, and given our role and function as police officers, we got to protect ourselves. We have to safeguard our country. And if too many police officers are affected by this virus, then the national security of our country, can be in peril. And that is something that we don't want to happen. So I just want to urge my colleagues to be responsible and protect yourself against the coronavirus.
With the number of rising COVID-19 with the number of rising COVID-19 cases in the country over the last 2 weeks, Health Promotions Officer Shanika John said the Ministry of Health, Wellness and the Environment is doing its best to formulate new strategies to curb the spread of the infection. Also on the Police Beat program, she noted that early detection is one way of reducing the spread of the virus and advised persons not to self-diagnose.
Currently, we are really working on early detection. And early detection is really just trying to identify those persons who are, one, symptomatic, which means you're sick or you're experiencing some flu-like symptoms for COVID-19, or even those persons who are asymptomatic. You're not experiencing any symptoms. You feel fine in your own definition. You may have one or two things here, but nothing alarming enough to send you to the hospital or to push you to seek care. And so we've definitely increased our capacity for testing. And so we've asked persons to really seek care early. My condolences to you and the rest of the police force for losing one of your colleagues. And so all of this is part of the reason why we really want to encourage persons to seek care early. Do not try to self-diagnose at home or try to wait it out. Sometimes something will happen and we say we're waiting it out.
John said the ministry has also been working hard to contain the spread of the virus in communities and has been carrying out testing in communities where there are small clusters.
And also we're really looking at containment. And containment has to do a lot with being able to contain the spread of the virus in country as well. It's really important for us to do that because it helps us to be able to curb and to slow the spread of any possible outbreak or severe clusters across St. Vincent and the Grenadines. So we've been moving across the different health districts and we've been trying to really test those areas that we're seeing a lot of cases, in different small clusters to see how quickly we could close those clusters and to be able to detect quickly.
Meanwhile, the Health Promotions Officer said that the molecular lab here has been managing thus far with the testing of samples for COVID-19. She, however, noted that the testing is a continuous burden not only in SVG, but also in the region and around the globe where test kits and test supplies are in high demand.
And so our chief laboratory technologist is continuing to ensure that we have adequate supplies in country to be able to continue to do our PCR testing. Currently in St. Vincent, we have two different types of tests that we would do. There's called the rapid antigen test, and there's also the PCR test. Before when you ask people what type of test did you do, they would say the one that you push up in the nose. But the thing is, both of these tests right now actually requires a nasal swab. So you then have to ask a little further. Is it the one that you got back your results within 15, 20 minutes? Or did they say that you should go home and I will call you? So that's the one that went to the lab. So the PCR test is a test that will go to the lab, the molecular lab, and they will do the processing, etc. The rapid antigen test is the one that they would use immediately in front of you. And you really want to use rapid antigen tests for persons who are symptomatic and where you're seeing a lot of high cases in a particular area.
John also noted that the Ministry of Health does not recommend persons testing before 3 to 5 days of coming in contact with someone who has tested positive for COVID.
In terms of the testing at the community level, I think people get very anxious when there's somebody who may have tested positive on the workplace, or you would have been in a gathering and then you heard somebody test positive yesterday and then you immediately run for testing today. We do not recommend that simply because if you're trying to pick up any sort of exposure from that particular incident, you're testing too early. The way in which the virus works, it takes about normal virus, COVID-19 virus, will take about up to 5 days before it starts to actually have antibodies sufficient enough to show up on a PCR test. Yes. Now that we do have the Delta variant in country, the Delta variant, which is much more aggressive and much more severe, can actually start showing up on a PCR test 3 days later.
The Health Promotions Officer further outlined some questions a person should ask him or herself if coming into contact with a COVID-19 patient, noting that the virus might not show up in the body right away.
If you test today after you've just found out that somebody in your workplace tests today and you test negative, that negative result is not a reflection of the exposure today from that positive contact. It's a result of what happened in the past. So 5 days ago, you had no exposure to anybody, so you're tested negative. It's not really an idea that, somebody in my workplace tests negative and boy, I go down and I get tested and I'm negative. It's a false sense of security, because what would start to happen is that 3 days later, if we're dealing with the Delta variant, or 5 days later, if we're dealing with coronavirus, the normal strain of the virus, you would start to develop symptoms, and in that period, you become infectious. And because you're not in quarantine, you may have, broken some of the precautionary measures. Maybe you would have taken off your mask. Maybe you would have interacted with your family and your children and so forth. And before you know it, the cycle continues.
And infectious disease specialist Dr. Gerald Thompson is encouraging parents to get children over the age of 12 vaccinated, as they are seeing more children contracting the virus. Dr. Thompson pointed out the many cases of children on Kanawhan who have contracted COVID-19.
We have been seeing a brisk increase, especially since we've started to see young persons becoming infected. I must tell you, I don't like to mention location, but I think it's well known in Kanawhan, there have been a number of persons, almost 20 persons, who may have contracted the virus, some of whom are below the age of 12. Now, the Pfizer vaccine has been approved for the age of 12 to 18. Some of these persons were 11 years old. I must say that the Pfizer has also just recently published that they are looking to get approval for the ages 5 to 12. And the studies have shown very promising for that group. But we may be a little way off from doing that here in St. Vincent and the Grenadines. And until we get that information, and so we wouldn't promote it for persons under the age of 12. But I would say that a number of parents have been bringing their kids.
Today, Tuesday, September 21st, is the due date given for 11 structures next to the Roruru River in Arnisvale to be vacated to accommodate the widening of the main bridge close by. 4 persons have been using structures as living quarters, while the others are small business establishments which have been in the area for decades. When our news team visited the area today, most of the structures were closed up. However, we spoke to some of the affected business operators and a resident. The small business owners say they are willing to relocate. However, they lament on that the 7-day notice given for them to vacate was too short, and that they should be compensated with a new site identified them to ply their trade.
It is too short, and they come and talk about proper compensation or relocation. So to me, it is not right. It is monstrous. It is not to move and don't want to move, right? If we had to move, we had to move. We come together as a group and we decide we're not standing with progress.
I think we just be satisfied, because when whatever little they think they're going to finish, then what is the next outcome for us? So we hoping that they could find some spots, because it's just a few shops, and everybody come to stall the vegetable, the guy behind the do foods, everybody depend and rely on this for the. So
if I have moved from here, I have a big loss. Yeah, son. Because what am I going to do? I had nothing else to do. Yeah, son. And if you're going to move me, give me something, give me some place proper that I could set up and start again. But it has to be in honest way.
Those whom our news team spoke with said it is unfortunate that they were never notified prior to the notice dated September 14th for them to leave the area. One man admitted that he was the first person to erect a structure in the area after he was granted permission to do so by a former minister of government.
35 years now I live around here. I live from here, so go right down. I want to put up the first structure, right? They have a problem, so they have to move, right? And when Mike Brown get in power now, just before he get in power, I talk to him, he say, okay, now we'll see what's going on. So when he gets in power now, I go back to him about 6 months after. He said, go and put up a little thing. And once nobody come and tell you nothing, you could add on. I say, all right, no problem. Just so he said to do, I do, until I add on and make it a little bigger and bigger. You understand? And I make my living from that.
Some of the affected persons say they have already considered legal representation to deal with the matter. Chief Surveyor with the Lands and Surveys Department, Keith Francis, said that an upgrade to the bridge close to the E.T. Joshua Center to allow for improved access to the temporary schools, which will be used for the new school year, is urgently needed. Francis said that 4 structures which are closest to the bridge will have to be immediately demolished. He said that plans to upgrade the bridge were in the pipeline years ago, and at least 1 person was notified at that time.
So after the E.T. Joshua Airport was closed, a decision was taken tentatively to open back the road across the airport that had existed some years prior. After some investigation that was done on the bridge and its structure, it was determined that it was not suitable to do so at that time. And we had started to issue some notices. One went out to the gentleman, Mr. Lloyd Brown, on the bridge, the guy who operated the bar on the bridge. After the decision was taken not to reopen the road, the other notices were not served to the other parties along the bridge. Sometime after that, when the traffic situation going into Kingstown became untenable, the police indicated that they thought it would be a good idea to open back the bridge. And at that time, the notice to Mr. Brown on the bridge was served. However, the other notices apparently were not served to the other persons because they were not directly involved in the reopening of the bridge.
The Chief Surveyor said that the Lands and Surveys Department has been working along with the Traffic Department, and it was based on their recommendation that the work is moving apace, as a pedestrian crossing has to be finished as soon as possible.
The police were tasked to come up with a traffic plan that would allow parents and public transportation to deliver the students, as it were, to their classes on the compound. The police have indicated that the bridge in its current capacity would not be suitable because the police want the bridge to be two-way traffic full-time, so that persons who are coming from Kingstown, who are going to drop their kids at school in the morning, will have to drive around to the roundabout and come down the VG stretch and enter the school compound from that bridge.
Meanwhile, Francis said preparations for the modern city at Arnesville is being catered for, hence the need to have all illegal structures removed.
Is going to be a 3-lane portion of road where vehicles that come out from the bridge will be able to turn left to go up to VG or go straight across to Arnesville, and the 3rd lane will be for traffic coming from the villa area to cross the bridge. So as it stands now with the vegetable stalls and the other structures, this is impossible. A decision was therefore taken to serve notice on these individuals, and at the same time looking at the future development of Arnesville, where the modern medical hospital, referral hospital, is to go, as well, of course, as the new schools, the E.T. Joshua Center, and eventually our new city at Arnesville. a decision was taken that it would be beneficial at this point to remove all of the structures on the bridge.
And the chief surveyor said that he had recommended compensation for the 11 persons who are the owners of the structures that have been identified for demolition. Francis said that this was done before they sent out letters of notice to the affected.
No, that was done before they asked for compensation. Of course, we're not going to demolish their structure without compensating them. The government does not operate in that way. But as I'm saying, the decision to make compensation does not rest with this department. The decision to make compensation, the amount of compensation, and the form of compensation does not rest with this department. We make a recommendation to Cabinet. Cabinet may consider our recommendation, or there are 13 or 15 of persons in Cabinet. There's only me here. The 13 or 15 heads might have a different opinion as to what that compensation should be. So until I hear from Cabinet, I am not in a position to say how much or what form of compensation it will be.
SVG will soon benefit from a Know Your Customer (KYC) digitizing program, which is currently being piloted in Barbados. SVG is likely to be the first country in the OECS where the program will soon be piloted. Head of Business Solutions and Innovations, Darrell Thomas, told SVG-TV News that Sharing, which is a technology company, has created a system where individuals and organizations can transact in a secure and trusted digital environment with contactless digital identity.
Your COVID vaccination, if you want to digitize that, you can digitize that. We are working with we're talking to different schools to digitize, for example, your certificates, like your bachelor's degree, your certificates of accomplishment. If you do the training, those things can be stored in your vault, right? Things like those IDs that I mentioned. After you do the KYC, when you get to the institution to do a transaction, right? If you forgot your purse or your wallet at home and you have your phone, because you always have your phone, you simply scan your QR code and it will identify you. It will show you a picture of one of the IDs and it will show that you are who you are, and then you can do your transaction without even have to physically walk around with your ID. So those things, and you can go as far as things like gyms, access to buildings, even, these days with COVID where when you get to, let's say, a restaurant or something, they ask you to take your name, your phone number, and your temperature. You can digitize that as well. So you don't have to go around. It can be contactless. You don't have to really pick up a pen and write down your name and write down your email address and your phone number. We can actually just scan the QR code and that is populated automatically.
Thomas stressed the importance of security and trust for financial institutions, which he noted is a key component developed by Sharing. He added that feedback from institutions in SVG towards the new program has been positive thus far.
Definitely companies who want to move towards that direction and innovate for their internal customers, their employees, and the external customers, the people that, pay their salaries, like yourself, they would be looking at doing this thing. So the response has been quite good. I cannot name the institutions that we are talking to in St. Vincent, but we are already discussing with institutions in St. Vincent. I think the next market we will go live with either a pilot or in production would be either St. Vincent or possibly Dominica. But we are already in deep discussions with institutions in your country. But it will be pretty soon. It just depends on how they want to roll it out, because it's their members, and obviously we have to respect their process of how they want to do it.
Police have arrested and charged Simeon McCree, a 29-year-old security guard of Bonham, with grievous bodily harm. McCree allegedly unlawfully and maliciously inflicted grievous bodily harm on a 42-year-old unemployed male of the same address by stabbing him in his left eye with a knife on Tuesday, September 14th at Bonham. The accused appeared before the Caliacua Magistrates Court yesterday to answer to the charge and pleaded not guilty. The matter was adjourned to Monday, September 27th. Station bail was continued for McCree. Meanwhile, the police are investigating a report of burglary made by a 37-year-old pilot of Arnisvale. Police say preliminary investigations revealed that between 9 p.m. on Wednesday, September 15th and 10:30 a.m. on Thursday, September 16th, some unknown person or persons entered the dwelling house of the said pilot as trespassers and stole a number of items valued at $14,600 EC dollars, the property of a 61-year-old retiree of Green Hill. The incident is said to have occurred at Arnisvale. Police are asking persons with information pertaining to the investigation to contact the Assistant Commissioner in charge of crimes at 456-1339 or the officer in charge of the Criminal Investigations Department at 456-1810 or any police station or officer you're comfortable with. The police say all information will be treated confidentially.